Education is the key to controlling Lyme and tick-borne diseases. Pat Smith, President, Lyme Disease Association, Inc. 46 years into Lyme disease, we don't have what we need most: widely disseminated, accurate information about Lyme and tick-borne diseases. This seems incredulous when CDC has presented shocking estimates of numbers of US individuals who have been diagnosed and treated for Lyme. From 2010 to 18, based on insurance claims, an estimated 476,000 individuals annually, a 59% increase over 2005 to 10 number of 300,000. This huge increase may be partly attributable to the actual spread of ticks into new areas, especially low incidence states with little focus on Lyme education, awareness, and tick surveillance. High incidence states may also have had an increased number of ticks and developmental patterns, bringing people into closer contact with tick vectors. Increased research surveillance documenting tick numbers and/or actual tick infection rates with spirochetes may have contributed to higher Lyme awareness, thus increasing individuals diagnosed and treated. Whatever the cause, it's clear we must significantly increase educational efforts in every area of the country. CDC reported cases for 2019, almost 35,000, show Lyme to be most prevalent in 16 CDC designated high incidence states. However, a Harvard Medical School study using positive lab test rates between 2010 to 16 from Quest shows a dramatic geographic expansion in the positive rate for Lyme across the nation, with high positivity rates in many states previously considered low incidence. This expansion is supported by a Fair Health database of over 23 billion privately billed healthcare insurance claims, showing significant discrepancies in 3 low incidence states between reported case numbers and healthcare claims numbers for a Lyme disease diagnosis. Although characterized low incidence, all 3 states rank in the top 5 for Lyme-related insurance claims: North Carolina, California, Texas. Today is about the need for public education for Lyme disease. The public is made up of many different groups of people with different roles in Lyme. Federal government has to accommodate all with different education levels. This task requires Congress to provide funds and direction for Lyme education. The public itself has a role in educating elected officials in Congress as to Lyme's impact on their area and families, and the unmet educational needs of Lyme disease. Doctors need to be informed that Lyme cases have been reported in all areas of the US over time, though it may be currently unclear whether it's being acquired in-state by residents or acquired out of state due to travel. Due to lack of government funding, little or no tick surveillance has been done in many low incidence states to see whether ticks transmitting Lyme can be found there, or whether they contain Lyme spirochetes, and if so, the infection rate of ticks. CDC states, quote, "Counties classified as no records should not be interpreted as the tick being absent. No records could be a result of a lack of sampling efforts, tick collections, or a lack of reporting or publishing the results of sampling efforts." If doctors don't understand, they can be reluctant to diagnose and treat in certain areas of the US. Reluctance can lead to delayed diagnosis and treatment, which can result in 20+% of patients experiencing continued debilitating symptoms after initial treatment. It can also lead to patients traveling great distances for care. According to MyLyme data, 31% travel 100+ miles, which leads to time delays, significant cost increases, and family and work disruption. Doctors need to understand issues surrounding Lyme diagnosis. 41% of respondents to MyLyme data patient registry did not recall a tick bite. Only 34% of registry respondents recalled an EM rash. The EM Lyme rash may not resemble the oft-touted bullseye rash at all, may look different on different skin colors, can occur at several places other than bite site if Lyme has disseminated, or it may not occur at all. Doctors hear that Lyme tests can show a false positive. Many don't realize there are false negatives. Early testing may not produce enough measurable antibodies. The work of Dr. Steven Schutzer and others show that antibody can be present but forms a complex with the antigen. Commercial tests only test for free antibody. The Virginia legislature, educated by its constituents, passed legislation requiring doctors to provide a disclosure that includes, if you're tested for Lyme and it's negative, it doesn't necessarily mean you don't have Lyme. Dissemination of information on transplacental transmission of Lyme disease, which can lead, untreated, to what CDC calls adverse birth outcomes, needs to reach pregnant women with Lyme so they can be under a doctor's care for Lyme during pregnancy. More information on Lyme carditis needs to be distributed. An early disseminated manifestation of Lyme, which often manifests as a complete shutdown of the electrical system, it can evolve rapidly over minutes, hours, or days, producing severe symptoms or even sudden death. Doctors and the general public need to be educated on all the aforementioned issues. The latter to know when to seek medical care and even to provide information to doctors who may not yet know Lyme is in their region, nor recognize the challenges of diagnosing and treating Lyme and other tick-borne co-infections. The public also needs to know where ticks are to protect themselves from contracting Lyme. Ticks are not only found in the woods, but are often present in the backyard. The mice that scamper around the yard and the cute little chipmunks and birds at your feeders may be harboring the Lyme bacteria, which passes to the ticks that feed on them. Those ticks then bite you, your children, and your pets. Deer are thought to be the only culprits in spreading Lyme, but they are really like the bus carrying the ticks all over a particular area. Proper tick removal is essential. Improper removal, still occurring, can greatly increase risk of infection by tick-borne diseases. A bite by any tick should be taken seriously and not dismissed. Prevention education is not generally a controversial area, yet prevention is often not practiced. For example, proper dressing for tick environments, safety and efficacy of sprays for clothes and skin, yard maintenance, and tick checks. Only when the public is educated to all the dangers of Lyme will they practice prevention measures. The past few years, government has been soliciting public input to help develop educational materials for various stakeholders. The Public-Private Partnership, HHS and Cohen Foundation, which has initiated LymeX and today's event, is a positive step. All need to be educated and to educate, pooling our ideas to make that happen. Thanks to all who made today happen and those who contributed to development of educational materials.